All right. Well, good morning, everyone. It is another fantastic Monday morning here at Health Plan Markets. I will tell you that it is a rainy day here in Orlando. So if you're in the Central Florida area, please drive safe on the roads today. It seems like, at least in Florida, when it starts to rain, everyone forgets how to drive. So be careful out there. For everyone else, I'm very happy that you're here. As a reminder, we are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. And thank you for being here live on the call. This is also being recorded on YouTube in case in the future you're unable to make a Monday morning call. We want to ensure that you have access to these calls on YouTube. Or if you miss half of it or have to jump off early, you can go back on there and check it out. So that is what's going on. Want to ensure that you guys have access to this as well. So as we jump in, as normal, we've got to keep one foot in the classroom and the other one in the field at all times. So we are going to jump over to our training calendar here on HQ. As a reminder, if you do not have access to HQ, please reach out to us at support@askhpm.com, or you can call us at 844-696-3975. Make it easy. There you go. All right, it's Monday, March 10th. This is the second week of March. We are wrapping up Medicare OEP right now, and we're going to talk a little bit about strategy behind that and getting ready for rest of year or lock-in, whatever you guys call it, for Medicare. And then also, what can we do for ACA, and then building deeper relationships with your clients. We're going to talk about that today. So first and foremost, for the training calendar, remember, if you go to HQ, it's going to live under learning, and then you're going to click training calendar here. We have a new surprise coming for HPM University coming next month, so excited to share that with you guys very soon. But for now, the live trainings are here. Later today, we've got United Healthcare doing their OEP training. So if you need some last minute training to button up open enrollment period for Medicare, that's today at 11. Devoted is doing SEP training. Can't get enough of that. I'll be honest with you. It is awesome to continue to learn about SEPs. Tomorrow, Cigna's doing open office hours at 9:30. We've got AARP Medicare Supplement, 60 Minutes to Success. This is a 1-hour training at 1 o'clock tomorrow. And then our partners at Spark, Understanding Extra Help and Medicaid, tomorrow at 3 p.m. Check that one out. Wednesday, our very own Al Clancy is available for Ask Al, virtual coffee and chat, every Wednesday at 9:30. So if you have questions, concerns, you need a coach, he's there to help. Cigna's doing a compliance training, a deep dive in Medicare Advantage. That is at 10 o'clock on Wednesday. We've got virtual office hours for our contracting team. Jumping over to United Healthcare Low Income Subsidy and Extra Help training. This is going to be really key and critical moving in for the rest of the year. That is at 1 o'clock on Wednesday. And then Cigna's got time management for sales professionals at 4 o'clock. Can't get any better than that. I love these. Thursday, we've got WellCare coming in the office at 9 o'clock. Check that out. Susanna from WellCare is going to come in and make sure you're doing what you need to be doing and learning a little bit about the value props of WellCare. Cigna is also doing a retention training at 10 o'clock on Thursday. Very good to keep your book sticky to you so you can continue to earn residuals. Humana is doing an Age In webinar. That's at 2 o'clock on the 13th. HQ Intro at 3 o'clock on the 13th. And then lots of Cigna trainings this week. We've got Cigna doing dual eligible special needs training at 4 o'clock on Thursday, as well as another training for that time management there as well on Thursday at 4 o'clock. So you can see a lot of these carriers now are thinking about trainings outside of the box. It's not just about their benefits. It's about really helping you get to the next level. And you know, this is a career. I'm going to stop for a second and just kind of get on my soapbox. This is a career, and many agents that I see, some of you on this call, can do double or even triple the production that you're doing right now by simply studying your craft, by simply reading, by simply attending courses, by simply investing in your skill set as a sales professional. I'm talking about doubling or even tripling your income, doing pretty much the same thing that you're doing now, but at a bigger scale, faster, stronger, smarter. Okay. That's why we do these trainings, guys. I hope you're listening. All right. Moving on to Friday. What About Shop is canceled this week, so Tom will not be on the 9:30, but Cigna will be doing another SEP training at 10 o'clock on Friday. Grassroots marketing at 11 o'clock on Friday. UHC is doing that, and then UHC closing the sale. Nothing gets done unless you close the sale. You don't get paid, your client doesn't get covered, the carrier doesn't get a member, HPM doesn't help you. So closing the sale, absolutely key and critical. If you're finding yourself losing sales from objections, or you're just not sure how to button it up, that could be a really key one there for you as well. So that is the training for the week, guys. And I'm going to remind you again, you must keep one foot in the classroom and the other one in the field at all times, at any level that you're at. I don't care if you've been in this business for 10 minutes or 10 years. I am studying every day. I read 1 to 2 books every week about business. That is me, because I am very focused on getting to the next level. And I do this because of the love of my craft and the things that I do, and to be able to support you guys and come up with better ideas and become stronger as a leader, as a business owner, as an insurance agent, as a sales professional, all the above. So I hope you guys take that to heart. It's a big deal. So I do want to jump over to marketing. And as we announced last week, we have a new addition to the team. Mr. Jose Aguayo completed his first week, and he's still with us. So thank you to Jose. I've known Jose for many, many years, and very excited to have him part of the team. And he is going to, again, I just want to reiterate, he is here to assist you with, number one, creating a grassroots marketing plan to grow your book of business, okay? Getting out in the community, networking, doing events, and generating leads at your own pace, okay? That is his job. So if you are interested in learning from a master of events, if you are interested in learning about the guru of community service and community outreach, Jose Aguayo is the man, okay? We are over the moon that he's part of our team, and I really hope that you guys take a few minutes, introduce yourself, and talk to this man. He is very knowledgeable, and I can guarantee you within 5 minutes you will learn something new that you can apply in the next 5 minutes of your life. So anyway, he's out there looking for events for agents that are willing to go out and get in front of traffic. Now, in this business, in order to get a sale, let's work backwards here. You want to get a commission check on Fridays, Thursdays, whenever the carriers pay you. If you want to get a commission check, that means you have to do a sale. Okay? Yes, Justin, thank you. So how do we get a sale? What's the next tier up? It's usually an appointment. Okay? You can't get a sale unless you have an appointment. How do you get appointments? To get appointments, you need leads. Leads are somebody that indicated, hey, yeah, I'm interested in this. Hey, yeah, let's talk some more someday. Hey, yeah, here's my information. Please call me. That is a lead, okay? To get leads, you need prospects. Prospects are people that are in the demographic that you're trying to market to. So if you're in Medicare Advantage, obviously seniors, right? People turning 65, people with disabilities, right? So that is those are prospects. So you need to get in front of prospects, right? And how do you get in front of prospects? You gotta have traffic. Traffic. Where are people coming and going? Where are they? What's attracting them? What's getting them out of their house and coming out? You know, Jose knows all the secrets. He knows what they come out for. He knows what you need to do to set up your table. He knows where to go, when to be there. He knows how to talk to them. He knows how to turn that traffic into prospects, prospects into leads, leads into appointments, appointments into sales, right? You must master that funnel. If you're going to maintain yourself in this business, you must master that funnel. You must master it. You must be good from top to bottom. And there's an inverted funnel on the bottom, which feeds back up. And that goes from retention, right? You need to make sure that your clients are happy, no buyer's remorse, retention, and then referrals. So those referrals feed back up to the top, and you get to mid funnel, is what we call mid funnel, because you don't need the traffic and the prospects and the leads at that point. Usually they're calling for an appointment because you've helped their cousin, uncle, brother, nephew. So they're just jumping right into the appointment spot, right? But you need traffic. And many of you on this call don't have enough traffic. You want traffic? Get busy. You need to get out to the community. You need to be at health fairs. You need to be in front of doctors' offices. You need to be at pharmacies. You need to be at network meetings. You need to be out there. And we have two amazing people that are out there crushing it right now. Again, Jose is going to help find those events. And then we have Chan, who's out there every day with agents that are willing to say, hey, I want to be at this event. And he's driving the van over there and he's helping to set up those events. So if you're in Central Florida, Chan is your guy. In other markets, we may not have a Chan unless it makes sense. But as we continue to grow, as we see you guys going out and building events, finding events, and learning how to do events, I think that's the first part of this, is ensuring that you guys are being successful in that, okay? A couple things in HQ I want to point out. We do have a marketing catalog. So again, if you need marketing materials, they are listed here in HQ. We've got flyers and postcards and social media ads and all that fun stuff that's in the marketing there. We have direct mail. If you're interested in doing direct mail, we have a partnership with directmailer.io. Mr. Mike Pope will help you set up anything from, getting a list to getting it in the mail. He does the whole kit and caboodle there. Great guy. He can help you with that. Events. We have an event request form here. If you're looking, or if you find an event, you can go ahead and plug it in. And then we have event swag. And this is, one of my favorite pieces here. In the event swag category, you can set up a tabletop, and we've got fun stuff that you can have on your table to attract people in order for you to do events. And we will drop ship this to you unless, you're going to be working with Chan and Jose on getting out there, in the local market. So that is out there. That is there today. Shifting gears here very quickly. Ancillary products, I want to continue to hone on this. Some of you are just doing ACA, some of you doing Medicare, some of you doing a combination of it, but very few of you are doing ancillary products. And I think that is a massive missed opportunity for you, where, OEP is going to close. You're going to be looking for work. You can go out there and find more clients. That's great. But what if you can add another $30,000 to your income with the same clients you currently have today? Not adding a single client, just talking to your clients about dental, hospital indemnity plans, cancer plans, critical illness plans that attach very nicely and seamlessly to their ACA plan, their Medicare Advantage plan, whatever they have, okay? And those products are going to be continually added onto HPM Shop, and we want to continue to add value there. So more to come on ancillaries. I'm really excited to continue to grow that. It will create stickiness with your book of business. So very excited to share that with you. All right, so we have some special guests on the line. I see Leela and I see Angela Fernandez, and I'm gonna add them in here to the call. And these lovely ladies are from Solis, and they are here to give you guys the good news about Solis and introduce themselves on how they can help you grow your book of business. So, hi, Leila. How are you? How's everything?
Hi, good
Hear us
morning.
okay?
How
We
are
hear
you?
you. Excellent, excellent. So, I'm going to go ahead and turn it over to you, lovely ladies. And we have some very excited agents on the line to hear more about Solis.
Okay, that's great. Thank you. Thank you. First of all, good morning to everyone. Thank you for having us today in this call. It's great to connect with all of you guys. My name is Leila Siciliano. I'm the broker sales manager at Solis Health Plans here in Central Florida. And also with me in the call is Angela Fernandez. She is the director of sales of Central Florida. Okay. Solis Health Plan is a Medicare Advantage plan, so I would like to invite all of you to get certified with us. Our process to get the certification is pretty easy, it's fast, it's quick, and we are a very complete plan here in Central Florida. I know that we're new. We have a huge expansion this year in this territory. We expand to, we are in Hillsborough, Pinellas, Polk, and we expand to Pasco. Also in Orlando, we expand to Seminole, Orange, and Osceola. So it's a huge territory. We're a very complete plan, very competitive. We only have 3 products, an HMO, a dual, and a chronic plan. And the great thing about us is our dual is for all levels of Medicaid. So you don't have to worry if it's partial, no partial. The dual members will receive the same benefits, and it's everything zero copay. We also have great benefits, like we still having PAPA hours. So we are of the carriers that provide the most hours in the industry for PAPA. And while other carriers reduce or eliminate benefit, we add those benefits. We have implants, we have breaches. We also have a flex allowance to help them to pay any out-of-the-pocket expenses for dental, vision, and hearing. We have unlimited transportation. Our copay for in hospital hospitalization is one of the lowest. In Tampa, for example, is $30 copay. It's $50 copay in Orlando. So I would love to you guys connect with me. I'm gonna be here to give you all the support. You can I can give you trainings one-on-one, online, in person, go over how to use our portal. We have event opportunities, as you were saying, that I'm agree with you. The most important for you as a nation is to be out there and have the exposure to those people, to get more people in your business. So we have events opportunities. I work in the past with Jose. It's great to work with him. So we know each other very well. And we have events, tabletops opportunities at CVS. So if you guys are interested on that, you can get in contact with me. And the first thing that you guys have to do is get certified. As I say, it's an easy process. You don't have any test or any long, boring video. It's quick. It's going to take you no more than 10 minutes to do it. I can go with you and help you to do it. I would like to give the word to Angela Fernandez. She's going to talk a little bit about our provider network.
Angela, you might be on mute.
Yes, I don't know if she...
There we go. Good morning, everyone.
Good morning.
How are you?
Excellent.
Good. Well, good morning to everyone. Again, it's a pleasure to be able to be on this call with you guys. I am Angela Fernandez, the Director of Sales for Central Florida for Solis Health Plans. And as Leila had mentioned, we, with all the changes in 2025 and all the carriers eliminating and reducing benefits, we consider ourselves a complete plan. Leila only gave you just a brief of the many benefits that we have here for Solis. In addition to, we have been around for 7 years. We started out in Miami, where we've had exponential growth in the last, I would say, 2 years since we had a fluctuation in leadership. We have grown over 500%. We started off 2 years ago with our brand new leadership with 1,400 members, and we are well over 11,000 now, and that is in a 2-year space. So, we are excited for those that are not certified to come certify with us. We are excited for those that are already certified. Let us know how we can help you to support you to see those numbers on the board. And as Leila had mentioned, we have event opportunities. We have CVS tabletops available. Leila is available to do group trainings, one-on-one trainings at your convenience. Leila has done trainings on the weekends at 7 p.m. over Teams, whatever it takes for us to be able to make sure that you're comfortable with selling the plan. So let me kind of jump into network, right? Because we know that that's just as important as the benefits. So with our network, as you know, we continue to grow, right? I think we have a very good standpoint as far as our network. We have a lot of the larger IPA groups. We have your IMAs, Orlando Family Physicians, your CareMax, your Palm Medical Centers. We have a lot of the smaller groups that are very well known in the area as well. I encourage you to visit us, speak to us, get more information. The great thing about Solis is that we can be flexible, right? We are an open panel, what we call ourselves an open panel. So what that means is we will continuously contract providers, right? Throughout the entire year. Our contracting process, we can get a provider credentialed in 30 days or less, okay? Now, for example, let's say you're in front of a prospect and that prospect sees XYZ cardiologist, and XYZ cardiologists save their life. They don't want to see any other provider, right? Any other carrier is going to tell you, well, unfortunately, they're going to have to choose one of the other cardiologists that are already in network. That is not the case with us. All we need is for you guys to let us know, hey, Leila, hey, Angela, I have XYZ provider that's not in your network. We will get our provider relations team on it and do the approach to contract that provider. If that provider is interested in contracting, what we can do is that we will provide a letter in 30 days or less. So again, I encourage you to talk to more information, get certified, all the tools and resources necessary in order to succeed with Solis. Thank you.
Got it. So there's, you talked about provider network. That's really interesting that you're continuing to add there. Hospitals, can you talk a little bit about hospitals and the game that they play there a little bit?
Absolutely. So in the Orlando market, we have Orlando Health, we have HCA. We're still in negotiations with Advent Health, so hopefully that will come into play very soon. In the Tampa market, we have Tampa General, we have Baycare, we have what's the name of that provider?
Yeah, as well in Tampa area.
Yes. So in Tampa, we have Baycare, we have Tampa General, we have a lot of the big ones there as well. So We're pretty much covered in all markets. I think really the biggest one is Advent Health again, which we're still negotiating with. So hopefully that will come into fruition soon. And as Leila had mentioned, we are one of the lowest co-pays when it comes to hospital. Again, in the Orlando market, it's $50 for the first 5 days. Polk and Tampa, $30 for the first 5 days.
Yeah, it's crazy. I saw those benefits and I'm like, wow. We just hope that you hold strong on those. And then just a note, guys, hospitals, they can use any hospital in an emergency. So if you're concerned about that, that's really not a thing. And then also if they're seeing a doctor that's in network with Solis and the doctor absolutely has to get a procedure done at an out of network hospital, they're going to work with the health plan to try to get that done. So most people are not going to walk in the hospital and say, hey guys, I need heart surgery. Can you get that done for me today? It doesn't really work that way, right? It's set up by the doctors and it's set up by the health plan and it's all pre-approved. So, hospitals, I'm not so concerned about. Providers, yes, you got to make sure that the doc is in network and is willing to take the plan. Angela, who's the best person that they should call? I don't know if you remember Eva. Eva's asking for the name and phone number of the provider relations rep. I don't know if you want to contact her and get her that info because she's very in tune with the physicians.
Yes, absolutely. So we have 4 provider rep liaisons. It depends on which market, but I can definitely pass on that information. Ava, I'm going to go ahead and put my phone number in the chat. Layla will as well. So you guys have our information, and you can give us a call and we can definitely give you that. And then as previously mentioned, we are in Seminole, Orange, Osceola, Polk, Hillsborough, Pasco, and Pinellas. And when it comes to the open panel, we're able to contract PCPs and specialists. As far as labs, we are with Quest and LabCorp, so we have both for them to choose from. We do prefer Quest only because it's a little cheaper, but they do have the option for Quest and LabCorp. So again, we understand that at least in the Orlando market, we've been in Tampa for the last 3 years. We've been in Polk for almost 2, and we just came into Seminole, Orange, Osceola, and Pasco in October. And we get it. There's hesitation. It's a new plan. I know that there were a lot of changes through AEP where you guys had to retain your book of business, and some of you really couldn't focus on AEP and new growth because you were trying to retain your BOB. But now is the time. We are a Heidi plan as well. Okay, so that's great for our Medicare, Medicaid members. Okay, so that's important as well. And while other carriers for 2025 separated their full and their partials, all levels of Medicaid fall under one plan at a 0 across the board. So I would say I understand the hesitation, but again, all your other big carriers that are in the market now, guess what? They also had a day one. They also came new into the market at some point, and the brokers and the agents gave them the opportunity. And I would highly encourage you to give us the opportunity, and you will see the local difference with Solis Health Plans. The great thing about us is that we are a private company. We are not public. We're able to resolve issues. You're calling us directly and we're resolving those issues for you. We're not having to send an email and it has to go to 10 other people all the way to the top to get something resolved. We will resolve those issues for you ourselves. Okay. We will reach out to whoever it is that we need to reach out to make sure that we're getting everything resolved for you in a very timely manner.
There was a question in here. Do you guys have chronic plans or not yet?
Yes, we have. Yeah, we only have 3 plans. We have our HMO core for Medicare only. We have our DSNP for our duals, and we have a CSNP plan. So under CSNP, it's going to be any cardiovascular disease, including CHF and or diabetes.
Awesome. There was also a question, can you put dialysis patients on your plans? I mean, your plans are not designed for that, but you can do that, correct?
Yes, correct.
Yeah. Okay. Awesome. Guys, if you're interested in adding Solis to your portfolio, There are two ways you can, well, actually 3 ways you can do it. You can call us, 844-696-3975, and we'll do all the contracting for you. You can email us at contracting@askhpm.com, or I'm going to show you how you can do it yourself right now from HQ. So you go to contracting, you would go to all HPM carriers. Okay, I've got this completely automated now. And then you're just going to go up here and you're going to type in Solis, and bada bing, get started. You're going to click get started. And if you don't yet have a contract with Solis, you're going to click start new contract. If you're currently contracted with Solis and you want to transfer over into HPM, you'll click transfer existing contract, and all the instructions are here to get you rolling in that. So very easy. You can do it yourself right now, or again, you can just shoot us an email or give us a call, and we'll get you loaded and ready to go. Layla, Angela, any parting words, any words of advice for these guys finishing up OEP and getting ready for rest of the year?
Yeah, absolutely. I think, let's add an additional business to your market, right? To all the carriers that you already represent. Again, we're making noise. People are asking for Solis. Prospects are asking for Solis. We've been very feet on the ground for a very long time to make sure that the community knows who we are. And again, we'll give you all the tools and resources necessary to make sure that you succeed with Solis. You have our support, from A through Z, from events to trainings to questions to anything. We are here and readily available. And again, as Layla mentioned, we understand that, certification process can be very long and lengthy. With us, it is not. There's no video, there's no module, there's no testing. We will have you ready to sell in 3 days or less. Okay. So I would highly encourage you to add Solis to your books.
Fantastic. Well, thank you guys very much. We appreciate you being on the call today and sharing the good news about Solis.
Thank you so much for the opportunity.
You are welcome. You are welcome. All right, everyone else, thank you guys for being on the call today. That's it for today. Remember, same time, same station next week on Monday. Please have a safe and productive week, and we're here to help you in case you need anything. Go get your Solis contract. We're ready for you. Send us an email. We'll get it rolling. Thank you guys. Have a fantastic week.